it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my partner is in intensive care after a motor vehicle accident with a head injury and is not waking up after 3 weeks. And that was part 2 of that question. You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers, and the question this week is: my 47-year-old sister is in intensive care with pneumonia, and the intensive care team wants to pull the plug. Help. This question from Jessica formed part of a one-on-one email counselling and consulting session with me. So, Jessica writes: Hi Patrick, my sister is in ICU in a medically induced coma and on a ventilator for pneumonia. She suffered a stroke back in April 2015. She has several issues with her heart, COPD, kidneys, and she now has septic blood poison due to her pneumonia. She's been in ICU for a week now, and I know they want her daughter to agree to pull the plug on her on Monday, when they all have this meeting with the doctors, the social worker and the family. I know her daughter isn't going to agree to it, but is there anything you can suggest, question-wise, we can ask the doctors when they suggest to pull the plug on my sister? She's only 47 years old, and when I was up in her room last week, I know she heard us talking, and when I left, she had a tear coming from the corner of her eye. Her rate of breathing would increase, and such while we were there, like she could hear us and everything that was going on. I can't control what God's will is, and if it's not His will, then I want a say in it as well as her daughter. I'm looking forward to your response. Thank you, from Bridget. Hi Bridget, thank you for your email and your question, and thank you for using my one-on-one email counseling service. I'm very sorry to hear what you and your family are currently experiencing with your sister's predicament and potential withdrawal of life support situation in intensive care. I can guide you through this situation, just as I have successfully done with many other families in intensive care, as I'm almost certain the intensive care team is trying to paint a doom and gloom scenario and a very negative picture for a number of reasons, and they may withhold critical information to keep pressing their hidden agenda and get what they want. They often do this for a number of reasons, mainly due to what's happening behind the scenes in intensive care. What's happening behind the scenes in intensive care and the insider knowledge that I can give you is what stands between families of critically ill patients in intensive care, getting what they want whilst making informed decisions, getting peace of mind, control, power, and influence. The fact of the matter is that if you don't have the insider knowledge and you don't know what questions to ask and how to correctly position your sister's critical illness, correctly position your sister's diagnosis and prognosis, as well as her care and treatment, you will almost always fight an uphill battle. Intensive care teams tend to be very shrewd and very adept in quote-unquote selling you of what they think might be quote-unquote in the best interest for your sister, without telling you and your family what they've discussed internally and behind the scenes prior to talking to you and your family. My first feeling is that at age 47, no matter the clinical challenges and clinical situation at hand, that a withdrawal of treatment and a limitation of treatment are certainly not in the best interest for your sister. She is way too young to be given up on, and 1 week in intensive care isn't very long, especially after pneumonia and sepsis. In fact, sepsis can be a byproduct of a severe pneumonia and needs to be treated with intravenous antibiotics, induced coma and mechanical ventilation accordingly. I have answered many questions from my clients in similar situations, and you can find many of those answers to questions from readers when you're checking out my Your Questions Answered section. In your sister's situation, the following is important for you to know. Very rarely would I have experienced or heard of a withdrawal of treatment or a limitation of treatment for such a young person with a septic pneumonia. I do understand that your sister has many health challenges with her previous stroke. The intensive care team probably thinks or even wants to use it as a justification that your sister won't have any perceived quality of life if she comes out of intensive care alive. I get very frustrated when I hear stories and justifications like that, because it's not for the intensive care team to judge what your sister's perceived quality of life is going to be in the future, because they simply don't know, and neither can or should they make a judgment on it. The intensive care team's job is to give your sister the best care and treatment there is available for her and make sure she gets the best shot at life there is. The fact of the matter is that despite the clinical challenges at hand, your sister is way too young to be given up on. And yet, intensive care teams tend to be very quick in suggesting that a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest for critically ill patients. What they haven't told you as well is that 1 week in intensive care is not a very long time. Not for a pneumonia anyway. Furthermore, you mentioned that your sister is in a medically induced coma, therefore she is right in the right situation to have the septic pneumonia treated. If the intravenous antibiotics, the induced coma and the mechanical ventilation don't help your sister's pneumonia, there are other treatment options that the intensive care team has, but obviously hasn't shared with you as yet. For now, it looks like they're keeping their cards very close to their chest. What you need to know is that for any form of reversible respiratory failure, and clearly a pneumonia is a reversible form of respiratory failure, form of therapy that might help your sister. The fact of the matter is that only few intensive care units offer ECMO therapy due to the specialization it takes to offer this advanced form of therapy for respiratory failure. It takes expert knowledge, specialized skills and many staffing as well as equipment resources to provide such ECMO treatment. It's a shame that the intensive care team hasn't offered your family and your sister such treatment, which shows me that they are not upfront with you and your family about treatment options. I've had a client recently whose 57-year-old dad was in ICU with cardiomyopathy, and they didn't offer ECMO as well. ECMO can be used for heart failure as well. My client's dad died without having been given the option in the first place, because the ICU didn't have ECMO as a therapy option available, and they were reluctant to refer my client's dad to another ICU. ECMO is usually only available in the bigger intensive care units. Nevertheless, you, your sister's daughter, and the rest of your family need to be given the option to have her transferred to another ICU where ECMO is available as a treatment option. Needless to say that not telling you and your family about these options and suggesting that a withdrawal of treatment sounds highly inappropriate and even negligent from my perspective. You also mentioned that you and your sister's daughter want to have a say whether the intensive care team is pulling the plug or not. The fact of the matter is that if you and your sister's daughter think that you won't have a say, you probably won't. This thinking and this mindset gets you right in the 99% bracket of families who don't question, who are intimidated by the perceived power and the perceived authority of the intensive care team, and therefore are not in a position to make informed decisions, get peace of mind, control, power and influence. Chances are that if you and your daughter think and believe that you will have a say in how to interpret and position your sister's diagnosis, her prognosis, as well as her treatment and care options, that you'll have a very good chance to influence the outcome. Therefore, you and your sister's daughter need to change your thinking and your mindset quickly that you will have a say in this. Full stop. Keep in mind, the intensive care team is just doing what they always do. They try and intimidate the families, especially when it comes to perceived end-of-life situations, so that they can withdraw treatment, let your sister die, and get the next patient in. Therefore, you and your family need to very quickly learn and understand that what you see is not always what you get in intensive care. There are just too many moving parts in intensive care, too many things that are happening behind the scenes that you need to quickly get an understanding about and then use to your advantage. What's happening behind the scenes in intensive care is often what makes or breaks how the intensive care team positions your critically ill loved one's prognosis, their diagnosis, as well as their care and treatment, or the lack of such. You should also check out some further resources that are put in the written version of this blog below. There are some ebooks around limitations and withdrawal of treatment that I wrote. I wrote ebooks about which questions you need to ask the doctors, and I also wrote ebooks about family meetings in intensive care that you need to know about in order to really have some leverage in family meetings and dealings with the intensive care team. So check out those resources when you're going down in the blog, in the written version of this blog, and check them out. Furthermore, before the intensive care team says that they think a withdrawal or a limitation of treatment might be quote-unquote in the best interest for your sister, they have probably also thought that you and your family may not challenge them and their positioning. Therefore, you and the rest of your family need to very quickly change your demeanor, your attitude, and you probably need to become difficult and demanding very quickly, since time may well be your enemy. After all, your sister's life is at stake, and she deserves, just like any other patient in intensive care, the best care and treatment. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly, whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me. Find international phone numbers on our contacts tab. Also check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counselling and consulting with me via Skype, over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.